Welcome. Dr. Morse here. We're entering episode number 5 of Eternal Vitality Podcast. Today we're going to talk about a product and available thing in medicine that I've been using for several years now that some people know about and some people don't. It's called Platelet Rich Plasma, or PRP. Now, this will be the 5th installment. If you haven't seen any of the other ones, I recommend that you check those out. The first one is kind of an intro. The second one is introducing something called peptides and BPC. The third one is just my take on why the American healthcare system is broken and some of the things we can do to fix it. And then last week's episode was about testosterone and how important it is for not only men, but also women. Now, there'll be plenty of topics coming. I'm making this as an informative but very educational podcast. We will have guests on. We will have all different levels. My goal is to not bore you. It is to inform you and educate you. Feel free to drop me questions or suggestions about the type of content you'd like to hear. If you have any, follow-up questions. As you can tell right now, there is no sponsors. So if you're interested in sponsoring, you can happily reach out to the email provided in the description and we can work something out. My primary goal is to not only educate you, but also to educate other medical professionals. Some people aren't particularly comfortable in many of these areas, and these are areas that I'm comfortable talking about. That's why these aren't just fluff pieces that are sharing a couple thoughts here and there. These are deep dives, fully researched. I usually spend about 6 hours or so researching each episode to make sure I have everything I want to talk about, and then I lay it all out. Now, many of this stuff, it has articles that are linked or different places that have been found. So I hope that you find this educational, but also helpful. If you have, a medical student or a nurse, PA, NP, any other physicians that are interested in this type of topic, and you'd find that you think that they'd find this helpful, do me a favor and send, this show over to them. And while you're at it, if you wouldn't mind leaving a review so more people can find this podcast. These come out Monday mornings at 7 a.m. and it'll be available on all your favorite platforms: Spotify, Google, Apple, YouTube. And if there's anything else, you let me know. I will try to put it on there. Okay, let's get started. So what is PRP? So PRP was first used in 1987 by Ferrari and a couple other people during an open heart surgery. So the goal, and I'll describe what it is in a second. The goal was to avoid excessive transfusion of homologous blood products, basically blood transfusions. So what is PRP? PRP stands for Platelet Rich Plasma. That's where we take blood out of the arm, we spin it down in a centrifuge, and we get the rich layer of plasma that has all the growth factors in it. In 1990, it was used as a surgical glue to seal difficult incisions, particularly in open thoracic cases and in plastic surgery using large skin flaps. So pretty interesting uses, almost 35 years ago. In 1991, it was then used by an oral surgeon to enhance wound healing in cancer patients. Most people are not aware of the origins of certain products or certain services, so I feel it's important to know this isn't something that just came out a couple of years ago. This has been around since 1987, at least that we have documented. I wouldn't be surprised if it was even before that in other countries. Now, in 98, orthopedic surgeons started using this to help repair bone fractures. So that's an interesting concept right there. The first time we heard about PRP in sports medicine, the 49ers quarterback Steve Bono ended up getting it injected into his Achilles in 1999, so 25 years ago. The Alan Mishra injected PRP in 2002 to chronic elbow tendinitis, and that's one of its earliest uses and most studied case studies about the body parts that it happens to help with. In 2006, the American Journal of Sports Medicine released a research that PRP helps accelerate tissue and wound healing, particularly in the elbow at the time. And then in 2008, Dr. Joseph Greco and Robert Brandt granted it for hair restoration. In 2009, many of you may remember this, Hines Ward became the MVP of the Super Bowl just 2 weeks after suffering a high ankle sprain, and he got PRP into that high ankle sprain to allow him to get back. Pretty cool. So, now it's ubiquitous. It's all over the place. Some people use it in the OR. Some people use it in office. And you can, it's all over. It's very easy to make. It can be inexpensive depending on how you process it. And it's very, very effective. And that's my goal today. If you understand anything, is that this is an alternative to a steroid injection, to a gel injection, to sometimes surgery. This has a lot of uses, is unbelievably safe as long as you know what you're doing, and is not overly expensive, and it has the ability to heal tissue. Maybe not 100%, but significantly better than the current state. And that's why it works so well. And as we'll say later, unfortunately, the rate limiting factor for PRP is that it's not covered by insurance. And that's not because it doesn't work. That's a separate discussion for why they don't want to pay for it. That doesn't mean it doesn't work. That just means they don't want to pay for it. So this will be the second section. What is, when you break down blood, what is it? So blood is 55% plasma, 45% what we call formed elements, red blood cells, white blood cells, so on and so forth. Now, on average, there's 250,000 to 400,000 platelets in blood, in a certain amount of blood. Now, you can be low in platelets. Most people aren't high, but technically you can be high. And it's usually the top layer when you look at it, when it settles, it's usually the top layer. Now, there's multiple different what we call types of PRP, and I'm going to try to break it down. There's something called leukocyte rich, which is usually referred to as red PRP. And this is the original PRP, the most common available one. It contains concentrated platelets, plasma, leukocytes, which are white blood cells, and large red blood cells. Now you have something called pure plasma, which is what I use, and that is just platelets, and the majority of the red blood cells and the leukocytes are removed. You also have the ability, and I do this every once in a while, to heat and cool the PRP to create a fibrin-rich gel. It's really thick. It's almost like hair gel. It's very, very difficult to inject. You can inject it. I do it into the knees. It's almost like a natural form of hyaluronic acid, but you have to kind of have the machine to be able to do it. You can also form a different type of platelet rich product that's called PRF. And that usually what you do is after you spin out the platelets, you turn it to about 4 degrees centigrade and for a couple minutes, and then that will crack open the platelets, and you can kind of aspirate that and use that as an even more purified form. There's many different ways to modify or make the PRP more potent. Some people talk about changing your diet. There's some people that want to say you can do different types of modalities before, or even get different types of IVs before getting your blood drawn to optimize the plasma and platelet concentration, platelet count, and growth factor count in that PRP. So what I need you to understand is that not all PRP is created equal. They're really different. In terms of white blood cells, this is a little bit more of the nitty gritty, but I'll go over this quickly. White blood cells or neutrophils should be as low as possible. They are high in MMPs, TNF alpha, and interleukin 1B, as well as interleukin 6, and those lead to high inflammation. We don't want that. Leukocyte poor is actually the best for joints, acute and chronic tendon injuries. The ironic thing is that the majority of the data is actually on leukocyte rich, even though we really don't use that as much. And the leukocyte poor is not as studied, but is actually a better product. Now, this is a little bit of a specific recommendation if you're a provider that's offering PRP. Red blood cell poor or low red blood cell count is best for the joints, and that's because the iron catabolizes the hyaline cartilage, which is a problem. Blood is toxic, basically. And then the tendons are okay with that, with the red blood cells, so it doesn't particularly bother it. Now, I have a tendency, if you've seen any of my videos on Twitter or TikTok or Instagram or wherever they are, I have a tendency to pull a little bit of red blood cells in mine because I like some of the inflammatory coat of that PRP. It's called the Buffy coat. And if you don't take that, I feel like you're losing some potency. But, I've had some other physicians say, well, you shouldn't do any blood because it's really inflammatory. And we just talked about that a second ago. But if you think about it, when someone has a bleed in the spinal cord, what do they use? They use what we call a blood patch, which is basically putting blood on there, and it helps to heal it and helps the headache to go away. That's not really much different than what we're using here. So in terms of platelet count, and this is where if you're an informed patient, you'll understand why I'm talking about this, because this is the difference between good results and great results. So the platelet count, we'll say on average is about 200,000, maybe 250. The studies show you need at least a 4 to 5x of that baseline in order to be truly considered PRP. So what does that look like? About 1 million or 1,000, depending on how how you're moving the zeros, to be defined as true PRP. So 4 or 5x baseline. So that we're looking at about 1.2 to 1.5, depending on how many platelets you have. Now, the studies that show with PRP with only like a 2 or 3x, so we'll say 400,000, 500,000, 600,000, that is not as powerful, not is equally as powerful as what we call platelet poor plasma, which is the weaker of the plasmas. So you really needed to have a 4 or 5x kit to make it worth your while to actually create positive change in that tissue. Now, when I'm with my patients, I usually describe the different types of PRP as different types of cars. And I know this sounds kind of funny and stupid, but this is the easiest way that I can relay it. So the lowest level type of kit, and there's probably, I'd say, 20 to 30 kits on the market. Each kit is a different brand. Think of it as when you process the blood, it goes into usually a plastic cylinder. We put an anticoagulant to help make it not stick and not clot. And then we put it into a centrifuge to spin it. Well, the collecting kit, the plastic kit, can be manual. It can be, there's many different ways you can do it. The weaker kits I call a Toyota Corolla. Now, these only do about 2 to 3x. They're weaker. They're not supposed to be super potent. They're usually only spun once in a centrifuge. And classically, we use them for hair and face. If someone's using that for a joint, you're not getting the true potency that you should be, and you're probably, underestimating the true potency and value of PRP. Now, the second line, or the most common kind of grouping, is what I call the Mercedes, and that's your 4 to 5x. These are the most common. There's a bunch of them. They usually don't give a lot of volume. So say you pull out 50 cc's of blood, maybe you get 2 to 6 cc's of PRP. That may be of 4 to 5x PRP. Now, that may be sufficient, but this will come back down to the injection style and why how I inject at the osteopathic center is a little bit unique, and why we've probably had such good results is because we don't just inject into a joint. We actually inject into each ligament or tendon that is responsible for moving that joint. So say the shoulder, for instance, most people are only injecting the inside of the shoulder, one injection. Or we'll say the knee, for instance, going only in the main part of the knee. Well, there's a lot of different ligaments and tendons that are responsible for moving that knee. You have the quad tendon, the patellar tendon, the MCL, the LCL, the ACL, the PCL. You have the meniscus, you have meniscofemorals, you have patellofemorals, you have coronary ligaments. There's many different parts to that knee, and none of those are going to get injected if you just put it inside the joint. So you're really not going to help 70% of the knee. So why I talk about this, because if you only have 4 or 5 or 6 cc's, you're not going to have enough product to put it everywhere you want to go. Because if you do, you're only going to put 1 cc in each area, and that's not usually enough. So when I do it, I have a tendency to inject 20 to 24 cc's of really strong PRP and spreading them out into each area depending on the severity of the damage in that area, usually determined by an ultrasound. Now, I happen to use something called the Ferrari kit. That's what I call it. There's only 2 or 3 brands that have data to prove that they get to a 7 to 10 times threshold of the platelets. So that you're usually looking at, 1.5 to 2 million cells, 2 million platelets. These are really strong. The kits are a little bit more expensive, but in my opinion, if you're going to do it right the first time. And that's what we do. So the issue with some of these is that they're uncomfortable. They can be quite painful, especially if your diet is not the best. And we'll talk about that in a little bit. So there was a study that showed there was a correlation between platelet concentration and what we call VEGF, which is one of the growth factors that we love. That's part of PRP that makes it so potent. These help to stimulate a chemotactic migration of stem cells or mesenchymal stem cells in a dose-dependent manner. Now, the platelet concentrate stimulates proliferation of the body's natural stem cells, and then, as the more potent it is, it's a bigger driver of those stem cells to say, "Hey, come! I need you to come fix this." Now, it's important to understand that PRP does not have any stem cells in it. It does not. You can get stem cells out of your bone marrow. You can get stem cells out of your fat. We have natural stem cells in our amniotic tissue, maybe a little bit in fluid in the Wharton's jelly, which is the umbilical cord. And that's really about it. But you cannot get it in blood. You'd have to collect a lot of blood. And even then, it's probably less than 0.1%. You're just not getting a whole lot. So anybody who tells you there is stem cells in blood doesn't know what they're talking about. So what is the process of doing PRP? So first of all, you coordinate, okay, here's what I'm trying to treat. Here's, the game plan. And then you get your blood drawn. As a tip for providers, do not draw blood with a really small syringe. You're going to break up those red blood cells, and you're going to have a lot of issues with that PRP. You're going to have to use a 20 or a 22 gauge to aspirate that blood out of the arm. If you use a 25 or 27, you're not going to get as good quality results. We've learned that over the years. So most people are going to try to get maybe 10 cc's of blood if it's just for hair or something like that. But you can do up to 120. I've taken out 240 before, depending on how much, where you're putting it, and how much you really need. Now, some people say, well, why would you take that much? As I said, if you need to put it in many different places, that's what you need. The good thing is your body's going to make more of it. I'm not overly concerned about that. And some people don't like to get poked every week or every other week. Sometimes you just need to hit it really hard once and just be done. So once you pull out the blood, we'll say, for us, we do 50 cc's, and then we add 10 cc's of what we call an activator. It's either calcium chloride or a thrombin or something along those lines. It just depends on the brand. Now, when blood is then transferred in, and you've probably seen me do this on a video somewhere, into a plastic cylinder, and then gets weighed out, put in a centrifuge, and balanced, and then spun for a certain period of time. Now, there's different protocols. Different brands have different spinning techniques and speeds and times. And some people only spin it once. That's it. They spin it once, or they do it by hand, and then they're ready to inject. The stronger the kit, in my opinion, the means you'll have to spin it twice. So I'll give you an example. When we do our hair or some of our mild face procedures, we're only spinning our blood once because I don't need it to be super potent. Now, if I'm doing a joint, if I'm doing a rotator cuff or a hip, a knee, an important body part that's beat up, I need it to be strong. That means I'm going to have to spin it twice so that I can get a really, really concentrated amount of platelets. So when you spin it the second time, you're going to have just plasma in there. And the heavier plasma, the stuff that's going to settle to the bottom, is the PRP. So I'm going to aspirate out the top. So say there's 40 cc's in the syringe, and I want 12 cc's of PRP. I'd pull out 28 cc's of platelet poor plasma or PPP, and the remaining 12 would be my PRP. Now, it's important to understand that you can then photomodulate or biomodulate and put some of this PRP into a light, which then can further activate it and make it more potent. You don't have to. I personally do because it helps to make our product stronger, as long as I have the time to do it. Now, what makes PRP so powerful? Now, there are 25 different growth factors found in PRP. That's a lot. But we're going to focus on basically the main 5 because these are really the most important ones. Now, there's PDGF, which is platelet-derived growth factor. This stimulates cell replication, promotes angiogenesis, which is the making of new blood vessels, and epithelialization. TGF is transforming growth factor, and this promotes an actual formation of an extracellular matrix, so kind of like a thick soup that you can create a healing with. And also it regulates bone cell metabolism. Now, VEGF, as I mentioned earlier, VEGF is vascular endothelial growth factor, also promotes angiogenesis, which is very important because at the end of the day, healing is all about blood flow. Without blood flow, you're not going to get healing. That's what this does. This drives blood flow, which allows for healing, which is exactly what you need to fix the issue. EGF is epidermal growth factor, and that helps the cells to differentiate and also stimulates some of the other cells to kind of wake up and get to work. And it also does some angiogenesis on its own. And then finally, FGF, or fibroblast growth factor, promotes proliferation of the endothelial cells and of the fibroblasts, which are super important, and also stimulates angiogenesis. So you have all these different growth factors telling the body, hey, give me blood, bring blood over here. I need your nutrients, I need your oxygen, I need you to fix this tissue. So I like to think of PRP and really to a greater extent, stem cell as the ultimate traffic cop. You come here, hey, here's what you need, you go fix that, you go do this. It's like a general contractor for a huge job site. That's what these are doing. So when you inject these into, say, the rotator cuff, the body says, oh, this is really beat up, I need to fix it. It's like, all right, here's what you need to go here, you need to go here, you do this. And it's coordinating with your body's stem cells and that tissue to fix it, because obviously it wasn't fixing it or it would have done it. So this is basically kicking up the speed of and saying, hey, and it really happens within about a 10-day window. That's the optimal period. It's going to last for several months and probably several years. But in terms of when is the majority of the heavy lifting, the first 10 days is usually roughly the answer we've seen in studies. So what body parts can you use this for? The sky's the limit. Literally every body part you can think of, we've probably done it. Face, hair, neck, shoulder, elbow, hip, vagina, penis, back, knee, ankle, foot, wherever. If you can find it and we can put a needle into it, you can fix it with PRP or at least help it. Now, I consider PRP as a mild to moderate injury option. Now, my clinic is unique because all I do is regenerative medicine. I don't do surgery. I don't do steroid shots. I don't do any temporary stuff. So when people come to me, that's because they want an alternative option. They want either something natural or they don't want surgery and they want someone who knows what they're doing and uses this all the time. Some people add PRP as an option. It's all we do. So why I say that is because the people that add it as an option, a lot of the times they're not super educated in it because it's usually the drug reps that are selling them the machine that kind of give them the insight. This is not something they teach a whole lot, or at least when I was doing my fellowship, they didn't teach a whole lot. And part of the reason why I'm making this podcast episode is to teach people about this, to be more comfortable with this. Now, on a scale of, say, 0 to 10 in potency, 0 being not impotent at all, and 10 being the most potent, tissue mobilizer and maybe not regrower, but stabilizer and improve the quality of the tissue, I would say PRP ranges from about a 2 to a 4, depending on the quality of the PRP. Something called prolotherapy, I'd say, is about a 1. And then I would say the stem cell lines probably start at a 6 or 7, depending on the quality of the product. So this is not meant to be super potent, and I'll describe what that means in a minute. but it does a fantastic job for a lot of tissue. And more often than not, it is going to create some positive change. I will warn you that you go a little bit backwards before you go forwards, because it does create some inflammation, and we're going to talk about that in a minute. There are some certain areas that do not heal with just PRP. Predominantly, the areas that we've not been able to heal, regardless of the quality of the PRP, regardless of how many times we've done it, is usually the labrum in the shoulder or the hip. The meniscus can, but it's a little bit stubborn. But any tissue that is a ligament that doesn't have a good blood supply, which is pretty much all of them, they really struggle with just PRP. A lot of the times they need a stem cell line. You may get a little bit of healing. You may get a little bit of contraction and strength, but it's going to be probably 20, 30% of what you're going to be able to do with a stem cell line. Now, cosmetic procedures. This has been around for a while. Many of you may have heard of something called the vampire facelift, which is literally what it sounds like. You're using your blood in the form of plasma to inject in the face, whether it's direct injection or dry needling, to actually heal and improve the wrinkles and the collagen and wake up some of the tissue to give it more depth and improve the quality of the tissue naturally, as opposed to something like a Botox or a facelift where you actually do surgery. Now, you can do this on the hair. It works quite well, actually. There's different levels. There's different potencies. Sometimes you can mix it with stem cells. But in general, it does a pretty good job. We do it at my office. We're not experts per se, but we are definitely do it more than the majority of places. And our injection technique is a little bit different, and we've had pretty good results. Some people are what I call like just super responders, where they only need one round and their hair grows back beautifully. Some people, you do it 3 times and it doesn't seem like it does a whole lot of difference. And I think that's some of the internal stuff they have going on. But it does work to regrow hair. Not super expensive, $500, $750, depending on where you're getting it done in the part of the country. And we'll talk about money in a second, because that's going to come up. This has been used, PRP, for many years for professional athletes, as we said. Now, over the past 5 years or so, I've seen there a shift away from PRP. And it's not because PRP doesn't work. It's because PRP is inflammatory and it's not as potent as stem cell. So a lot of the times when you have a professional athlete, and a lot of my patients are professionals, they don't want the inflammation of the PRP. They can't function the next day or the day after if that body part is too inflamed. They really need to shut it down for a couple weeks. So most of these patients end up choosing a stem cell line because it allows them to return a lot faster, and it's a lot stronger. So they probably maybe only need 1 round, and they may not ever have to address it again, or it may buy them a year or 2, whereas PRP usually goes in rounds of 3. And oftentimes you're going to probably have to do it again, depending on the severity of the injury. Now, what are the most common side effects of PRP? Now, the approach I use for the body parts is ultrasound guided. I don't like doing what we call blind or landmark guided. You can do it X-ray or C-arm guided. I do that sometimes, depending on where I'm injecting. So you want it to be very specific. You don't want to randomly put it. You need to know where it's going, because you want the needle tip to be in the injured tissue, so it doesn't have to worry about looking for the tissue to fix. It just literally goes and starts fixing it. Now, unfortunately, PRP is quite inflammatory. And it's usually within about the first 1.5 to 2 minutes after getting it injected, literally almost immediately. You do not inject PRP, at least except for I'll say besides the hair, without numbing medicine. We usually without lidocaine or one of the derivatives of lidocaine, because it is really painful. Now, the weaker kits might not be too bad, but the moderate, the Mercedes and the Ferraris, no. I'm telling you, do not even fathom it. I don't care who you are and how much of a pain threshold you have. Don't even try it. To give you an idea, I've had people that I injected with lidocaine, injected their shoulder, and they've literally passed out from the pain. I've had a military guy who had been shot multiple times in Iraq tell me that PRP was more painful than getting shot. Now, I don't know if that was his inflammatory response or if he was being serious or whatnot, but some people really have an issue with it. Some people, it's like nothing. They're like, oh, they're fine. They don't. I had a lady last week fall asleep while I was doing it. So everybody's a little different. It's very variable. You know, in general, as long as you clean the skin really well, and you notify the patient of what they're going to expect, most people do fine. If you do not warn them that this is going to be painful, you're going to get some phone calls and you're going to have some very pissed off patients. So I usually tell the patients they're not going to be a big fan of me that night. The next day will be better, but you will not like me the same night because it's going to drive you crazy. For my patients, I prescribe narcotics when I do PRP because you really only have a couple options. You don't have the luxury of ibuprofen or Aleve or any of the anti-inflammatories because you want to create inflammation. That's how it works. Those are anti-inflammatory. Those are going to decrease that swelling. You're counterproductive. So you have Tylenol, you have like turmeric and curcumin, you have CBD, and then you have narcotics. That's it. You don't have to take any of them. Those are just to help with the pain. They do not make the healing any better. They allow you to function. And I usually only prescribe a couple days worth because I don't want you to have to rely on that. I just want to allow you to sleep the first night. But I do want you to move it. And that's where most people sometimes go wrong. But they put it in a Band-Aid, they put it in a sling. They're using a wheelchair. Like, I don't baby my patients at all. They walk in the same way they walked out. They are not in a sling. They are walking out. If I do the knee, shoulder, foot, ankle, they're hobbling out. I want them to use it. The next day, you might not want to use it, but if it's your shoulder, I will have you use the other hand to walk up the wall. The faster you start activating it, the better off it works out and the less downtime you have. So there's certain body parts, PRP-wise, that are really uncomfortable. For what it's worth, the penis isn't particularly painful. You use a numbing cream. It does look a little crazy, but it actually does a pretty good job with sensation. A little bit of girth, probably not so much length, but it does a pretty good job. Now, I would say the bottom of the foot is by far the most painful thing there is. The palm is a close second, but the bottom of the foot, whether it's plantar fascia or a fracture or a Liz Frank or anything along the heel, it is awful. I mean awful. So, and that's with numbing medicine. Sometimes I knock my patients out with anesthesia. I had one the other day. She was moving with anesthesia. She was completely knocked out. And I was injecting the bottom and top of her foot, and she was moving. That gives you an idea of how much the bottom of the foot hurts. In general, just understand that the bottom of the foot is rough. Some parts aren't that bad. And then some parts, obviously, a little bit more uncomfortable. The more experience the provider has and the more you prepare the patient, the better off they'll be. Now, the good thing, the safety profile for this, if you think about it, is absolutely amazing. You're using your blood to fix yourself. That's it. You're using your body to fix you. There's really not a whole lot safer you're going to get than that. The only thing you're removing is the red blood cells and some of the plasma. You're just using a very small amount of concentrated plasma. That's it. Now, yes, I understand it creates pain. And as long as the physician or provider knows where to put the needle, you're okay. In the shoulder, there's certain angles. If you put the needle this way as opposed to this way, you will be in the lung. That's a problem. The problem of safety profile for PRP is usually on the provider, not for the actual product. Now, I will say one caveat. If it's deep in the hip, some people have a really inflammatory and they are hurting and they think something is wrong. It's usually not wrong, but it can be very uncomfortable. Okay, let's move on. So price-wise, where are we at with price? So this is very, very variable, okay? Now, I've seen as cheap as $200, $300. I've seen as expensive as $3,000. Now, there are very different variables for that. Some of them is quality of the kit. Some of that is experience. Some of that is location. and some of that is just sheer number of injections and quality of the injections. My clinic is on the more expensive side, but we also have the best PRP that I can find that money can buy. And I'm also doing a ton of injections that are all ultrasound guided. So, when I do say a knee or hip, it's about $1,500. It is not a cheap kit, but you make substantial progress because of the injection technique, because you're getting 12 to 24 cc's of PRP. That is super potent. Now, it's important to understand that usually PRP goes in rounds of 3. Now, you don't have to do it in rounds of 3, but more often than not, I've seen the most success with 3 injections, whether it's Monday, Wednesday, Friday, whether it's once a week for 3 weeks, whether it's one of my normal protocols is Friday, Monday, like Wednesday or Thursday, and then you just hit it really hard and then you send them on their way. The reason why we've noticed is that with we've been able to fix, quote unquote, 80% of injuries with 2 rounds. The other 20% of people take a 3rd round. The problem is I don't know if you're in the 20% or in the 80%. If you can afford it, do all 3 rounds and be done with it. If you just want to try PRP, see how it is, you can do that. But just realize that you're probably going to need another round. And if you only do 1 round and making your assessment, you're probably going to be a little bit disappointed. You say, "Oh, it was good, but it didn't do enough." It's because you didn't do the full protocol that you really should do. Now, people often ask, like, when should I evaluate this? How long should I wait to say, hey, did this work or not work? And that's a great question. For PRP, I usually say about 3 to 4 weeks from the injection date. Where are you at with it? Is it significantly better? Do you have better range of motion? Do you have decreased pain? An increased ability to do things or more often than you previously could? Where is it at with you? And then you make a decision. Hey, do we need to do it again? Now, if you're talking about stem cells, that number often jumps up to about 3 months because those take a lot longer, and those are usually trying to fix things that are much worse. So you got to kind of get a gauge. It only takes about a month for PRP, but really 3 months for stem cells. Now, you're going to see progress before that, but that's when I want you to say, hey, where are we at with this? How much did it work? For me, I don't really worry about whether or not it's going to work. The question is, what percentage of your pain is gone at a month with this product versus that product? Continuing on. So I mentioned volume injected earlier. Some people only inject 2 to 3 cc's, in the knee or the hip or the shoulder or whatever. Some people like myself inject a lot, but again, that has to do with the technique style. And some people in some body parts, you can really only put in 1 to 2 cc's. You can only put in 1 or 2 cc's in a thumb. That's all you can fit. Yes, you can inject some of the other ligaments around it and tendons around it, but that's all you can really fit. Whereas a hip or a shoulder or a knee, there's a lot of different parts that you can complement that, if you're going to put an appropriate amount, maybe you put 3 or 4 cc's of PRP in each section. If there's 6 sections and you do 4 cc's in each, that's 24 cc's. So that you need to take that into consideration. Is this covered by insurance? Kinda. So the only insurance that I've ever seen cover this is TRICARE, which is the military. And it's only for the knee and for the hip in certain indications. Should they cover it? No question. Why they don't cover it, that's a separate discussion. I'd refer you to my episode number 3 if you want to look into that. So what are some post-injection expectations? Depending on the potency of the kit and the factors involved, it will vary. So, the first night, I usually tell people you're probably going to have about a 5 to an 8 out of 10 in pain. Unfortunately, that is common. Some people get lucky and they get up 2, 3, 4, and it's not bad. Some people are on the opposite end of the spectrum, maybe 10%, and they're utterly miserable. But usually, the bell curve wise, I'd say majority of them are 5 to 8 out of 10 in pain, and each night gets better. Usually 3 or 4 days later, they're fine. The first night, it's just rough. Now, they feel a heaviness, a throbbing and aching, sometimes numbness and tingling. sometimes their body goes into a fight or flight response because of the acute pain and the release of the growth factors, and they feel like they're getting chased by a bear. They're sweating. That can happen. I've seen that happen, and that may exhaust you for 12 hours or 24 hours before your system resets. But that's indirectly, not super common, but it can happen. Now, some people just get lucky and they don't really feel anything. They get the benefits, but they don't get any side effects of the actual injection. Whereas other people, they're miserable and they're like, I will never do that again. So I personally correlate, and I don't know if I've ever seen any studies, I've really never looked, if there is a correlation or a connection between quality and inflammatory response, in a bad way, of PRP to diet and lifestyle. I've noticed that my healthier or super clean eating patients have a tendency to have prettier PRP, which means it usually looks very clear. It's usually a yellowish color, and they don't get a huge inflammatory response. Whereas other ones that eat a lot of garbage food, that have high inflammatory markers, their CRP, their ESR, their homocysteines are all elevated, they have really inflammatory PRP, and they often are struggling. And unfortunately, there's only so much I can control. Now, you can start with icing for the first couple hours or day, but normally I recommend heat after that. It's going to be more effective if you do that. Now, I mentioned earlier, you can't do any inflammatories for about 10 to 14 days. That's roughly the average number. More often than not, that's kind of what I usually recommend. Most people try not to take them anyway because of their kidney and liver and blood pressure issues. But unfortunately, if you're dependent on those, you might have a little bit of a tough time with the PRP after the fact. So you have your turmerics, your curcumins, your Tylenol, your CBD, and that along those avenues, which does work, and then the narcotics. Steroids and prednisone and stuff, those are just super potent anti-inflammatories, so obviously those shouldn't be used either. Now, personally, I recommend physical therapy for pretty much all my patients. I like to think of an injury out of 100%, I get 60% healing with the injection, 40% with physical therapy. The reason why I say this is because with an injury, we naturally develop compensation patterns. If this hurts, maybe I start doing it to the side or to this side. Well, the problem is after you inject it, the body's not going to naturally go the way it's supposed to go. You need to retrain it to go the proper way. In my mind, it's almost like you're driving in the middle lane of a highway, and that's normal and that's perfect. And you develop an injury and you start shifting to the right lane. That's with an injury. Now you need the therapist to put you back in the center lane and help you stay there. The issue oftentimes that people, one of the reasons why they get PRP is because they struggle with the tissue not being able to hold the joint in the right position. So they're like, I get there, but then I feel like it just goes backwards, and then I'm at this plateau. I can't get any farther. That's usually an indication you need an injection, whether it's stem cells or PRP. And then after that, the tissue is going to be able to handle that correction, and now you'll be able to start doing better and take off. Now, some of my patients, usually my professionals, will start therapy the next day. Normal people, usually 3 to 5 days later, depending on their schedule and how in pain they are. My goal whenever I try to send it to a physical therapist is I want them as hands-on as possible. I want them doing something called Graston, dry needling, manual therapy, e-stim, cupping. I want them working on it. And the problem with America's healthcare system is that they devalued physical therapists. They paid them garbage money with insurance-based models, and most of them have to see 5 to 7 patients per hour collectively to really make any money. They're not going to be able to do a lot of manual work in that type of system. So most of the good physical therapists are out of pocket. You will go less times and you will make a significant amount more progress. But unfortunately, you have to invest in your health, and it is worth it. Trust me, I do it all the time, and I get fantastic results. Final thoughts on this section. When is it safe to return to play? Obviously, it's variable, in my opinion, I usually defer that to the physical therapist because they're the ones who are watching them, understand their biomechanics, understand what they're trying to get back to, and usually have them do it in front of them. And if they can't do it in front of them, they shouldn't be doing it on their own yet. For the people that don't do physical therapy, I usually tell them about 2 to 4 weeks, really depending on the injury, the severity, and really how they're doing. My goal is to not inject you every month or every 6 months. I'm trying to fix the tissue as much as I can, so that it can handle. You are a significant decrease in pain. You have a lot less inflammation. You are able to do a lot more with that body part, and just really not have any fear to go back to, playing paddle, or bicycle or swimming or golf or tennis, whatever it is. I want you to be able to get back to that quality of life. Whether or not you want to do it is up to you, but that's the goal of my injections. So if you're not able to get there, then you haven't done a good job yet. Either that or you didn't choose the right product or fix the right tissue. But in general, that's, in my opinion, the ultimate goal. So I hope you enjoyed this episode. I hope you found it helpful. As you can tell, I'm passionate about this topic, and this is something that I pretty much discuss every day. So it's pretty easy for me to talk about it. I talk about this stuff at stem cell conferences, at all different places. So I hope you learned a lot today. If you have any questions, feel free to reach out. Either in email or on my Twitter or Instagram or wherever you can find me. You can call me at the office. I'm usually at the Miami office at the Osteopathic Center, and we'll be happy to answer. Let me know. I'm just here to try to spread the word about a fantastic product that works really well, that unfortunately a lot of providers just don't consider because it is not paid for, but it is worth it because you're actually structurally changing the tissue and not just kicking the can down the road and making the tissue worse, and which is usually what a numbing or cortisone injection is going to do. And I'm trying to prevent people from having surgery if all possible, because unfortunately there's a lot of issues with surgery that you can prevent with regenerative medicine. If it was covered by insurance, I would have a line around the block. Unfortunately, it's not. So my goal is to let the people know that can afford it, that it is a fantastic option. Thank you for watching. Please share this with your friends and family, especially if you've heard of PRP, if they're considering PRP. Ask your physician about these questions. Ask them what kit they use, or where are you going to inject it? How much volume are you going to inject? How many times have you done this before? If they haven't, feel free to have them listen or watch this podcast, and maybe they'll learn a point or two. Next episode, I haven't really decided. It might be stem cells. It might be something else, but that'll be available next week. Check out some of the other podcasts. We've already released episodes, and we will see you next week. Thank you for tuning in. Do me a favor and leave me a review. Thank you.